This patient who visited us was told that he had this bone loss because he didn't brush his teeth. This patient lives thinking that his problem is caused by himself for not brushing well. But I want you to observe one thing. See how much tartar there is, how much plaque there is. There isn't any. The patient arrives super clean. That is, he cleans super well, he uses dental floss, but look, he has no plaque. So the question is it really like this because he doesn't brush well, because the patient lacks hygiene? And this is where we must be very careful because if we tell a patient the cause of their problem, but it's not the right one, not only will we not help them, but we can also harm them because they'll believe they're brushing poorly and keep brushing harder, but they're not seeing what's really causing the problem. And therefore, they'll keep coming back to the office with more bone loss, more recessed gums without addressing the root of the problem. And what I'm going to tell you next made me feel quite sad, but it's the reality. One out of every four adults over 60 years old in the world doesn't have a single tooth. Not a single tooth. Imagine, one out of every four. But how many of those patients actually lost their teeth due to cavities or a lack of hygiene? And this is where the most interesting thing comes in. Most of those patients lost all their teeth, but it wasn't due to a lack of hygiene or cavities, it was due to periodontal disease. And periodontal disease, which is when you lose bone and gum tissue, has many causes. It's not just poor hygiene. For example, in this patient, we have to look at the bite. The bite can also be super complex. If this patient is missing teeth and is only biting with one part of his mouth, the front teeth are going to start coming out. They're going to start performing functions they shouldn't be doing. They're biting with the teeth that should be cutting or guiding the jaw, and that's why he might have this problem. But there's also something called genetic susceptibility. What does that mean? That many patients have an excessive loss of bone and gum tissue to a bacterium that other patients probably simply don't react to. It's like when a thief enters the house and instead of one policeman coming to get him out, 200 policemen arrive and destroy the house. What's the difference? It wasn't the beef. The difference was how the body reacted. In this case, the policeman to this thief. And we have to remember that the mouth isn't just on its own, we have a whole body. In this specific patient, he had uncontrolled diabetes, he had hypertension problems, and he also had cholesterol problems. So all of that came together and caused these problems. He even had a severe vitamin D deficiency. Therefore, friends, when we see a patient like this, we can't just blame the patient's hygiene, and we have to see periodontal disease as a kind of syndrome that's caused by many factors. Because to help this patient, we have to think far beyond his mouth. If you're interested in this topic, follow me and I'll explain.